Today was the last day of the N.W.T. Legislative Assembly's fall sitting. Discussions about health care and housing dominated the session, and they were also sticking points in the capital budget. That budget passed yesterday without any major changes, despite members saying they wouldn't support it as is. Natalie Pressman has more.
Last week, Inuvik MLA Denny Rogers said that regular members need more money for housing and health care to support the capital plan. But yesterday, he voted in favor of the budget anyways.
I do not disagree. Housing is one of our main priorities, our top priority, but there are other priorities as well, and there are things in this capital budget that I want to see move forward.
That was the main message of the 11 members who voted in favor of the capital budget. It passed in an 11-5 vote. Shauna Morgan, Kieran Testart, Robert Hawkins, Julian Morse, and George Narasu voted against passing the budget. The majority of those in favor were members in cabinet who voted together. The $339 million plan includes projects across the Northwest Territories, like progressing the Mackenzie Valley Highway, updating the Frank Channel Bridge, and transmission lines in multiple communities. Voting against the budget would have meant delaying all those projects.
We aren't going to advance the issue of needing housing if we can't bring the supplies up on the road, particularly the Mackenzie Valley Highway. We aren't going to be able to connect those houses if they can't be connected to power systems. They are going to struggle if the municipal funding, the municipal capital funding that is in here doesn't flow to the municipalities who are responsible for water and sewer systems, who are responsible for the waste management systems. It does all need to fit together.
The members who voted against the budget said they just didn't see their priorities reflected, including health care. Many of the issues members are trying to advance are operational, like staffing challenges, which can't be addressed in the capital budget. Outside of budget discussions, members voted to ask for a review of the territory's entire healthcare system. They're asking the Auditor General of Canada to audit the performance of the N.W.T. Health and Social Services Authority. This comes on the heels of this week's damning Auditor General report into Stanton Territorial Hospital project that went 62% over budget. MLAs said the audit would be a tool to help improve healthcare.
To name a few, Mr. Speaker, occupational therapists, speech-language pathologists, countless different nurses, a number of different doctors working in various roles in our system, people who've worked in management, people who have worked, and many people who are working on our front lines. All of these are people whose opinions and perspectives I deeply respect and have listened to with significant concern, because they have come to me in desperation and told me that they are on the verge of leaving or have already left their positions in our healthcare system because of significant issues with how the system is being managed. In particular, the overwhelming message I have heard from practitioners is that they feel their voices are not being heard by decision makers.
If the Auditor General accepts the request, it could take years to complete, and members say there needs to be better staffing and systems in place in the meantime. Natalie Pressman, CBC News, Yellowknife.
Meanwhile, the Northwest Territories Medical Association is calling on the territory to do more to prevent disruptions in healthcare and emergency services. In a news release today, the association says it wrote a letter to the Premier and the Health and Finance Ministers saying staff shortages and systemic challenges in the healthcare system are putting patients at risk. The association says it's alarmed over the Auditor General's findings into the Stanton Territorial Hospital project and says patients are paying the price for the government's failures. Recommendations in the letter include more staffing, strengthening emergency care, reducing administrative barriers to care, and supporting more culturally competent care.